Hi, my name is Billy, and today I'm going to teach you what I know about the amazing process of blood clotting, or in medical terms, hemostasis. We have all cut ourselves at some point in our lives. We initially feel the pain thanks to those nociceptors. Inside our bodies, our cells jump into action to help us out. They know their jobs well, and they get to work almost immediately. So what are our tiny cells actually doing and who's involved? Let's take a look at the process and break it down into the three major parts. We know that hemostasis is a physiological systemic process that our body uses in response to vessel damage. Whether the damage comes from internal complications or external trauma, the goal is to prevent excess blood loss. We have three stages. First, spasm or vasoconstriction of the vessel, followed by primary hemostasis or the formation of a temporary plug, and secondary hemostasis, where we rely on the coagulation cascade, which brings into play many different factors that eventually lead us to a durable clot. In our picture here, we can see the three stages represented, including the different tissue factors that are activated. Depending on the site of the injury, the response will be slightly different. With the intrinsic pathway, we have vessel damage coming from within the body, and with extrinsic pathway, we have the vessel damage coming from the outside. Whichever occurs and whatever pathway is activated, we will always lead to the common pathway, which is when we see processes involved in getting from prothrombin to fibrin to seal up that area of damage with a durable clot. The first reaction to vessel damage is going to be fast. The vessel is going to start to spasm to constrict and reduce blood flow to the area. This constriction is due to endothelial cells binding and smooth muscle receptors of the vessel wall contracting as part of an autonomic response. Our body knows based on many factors how much or how little the degree of contraction needs to be in comparison to the severity of the wound. Additionally, we will have an activation of the sympathetic nervous system due to nerve endings in the vessel wall, detecting and signaling the brainstem. This activation of the nervous system helps us by releasing norepinephrine to aid in continuation of vessel constriction, while the next steps start to kick in. This becomes a very important part of controlling bleeding in large vessels where blood loss can be rapid. Immediately upon injury, platelets that are floating around in our bloodstream notice the damaged area and begin sticking with some help from exposed collagen and von Willebrand factor. The second phase also happens almost immediately upon injury, within seconds, but may take a few minutes. This step involves the platelets adhering, activating, aggregating, and changing shape to increase surface area. Immediately upon injury, platelets that are floating around in our bloodstream notice the damaged area and begin sticking with some help from exposed collagen and von Willebrand factor. Von Willebrand factor is our own biological brand of glue, acting as a bridge between the collagen and platelets. It ensures that platelets have a strong hold by itself binding to the collagen in the exposed wall of the vessel and then grabbing hold of those platelets, increasing the ability of cells to stick to each other and to the wall of the vessel. In some cases, a bleeding disorder may be due to a lack of von Willebrand factor because without it, it is harder for the platelets to stick. Activated platelets also release their own substance like ADP for the release and activation of additional platelets, thromboxane, which also ensures the sticking of platelets, vasoconstriction, and inflammation, along with serotonin that signals the smooth muscle cells to contract. Secondary hemostasis involves the coagulation cascade that will lead to the platelet plug being reinforced with fibrin mesh, forming a stable clot. Coagulation factors are inactive enzymes that are in the blood that need help from the liver and vitamin K, which helps make clotting factors, and calcium, which plays a key role in activation of the clotting factors. The coagulation pathways are the extrinsic path, which is triggered by tissue factor and is a rapid activation, and the intrinsic path that is more involved and is due to injury from within our body. Both pathways lead to the common pathway, factor 10, which takes us through the process of changing prothrombin into thrombin with the help of factor 5. Activated thrombin then converts fibrinogen into fibrin, making our platelets stabilizing fibrin mesh to reinforce our clot. This whole process is finished up by those platelets contracting with the help of actin and myosin to reduce the size of the clot, while bringing the edges of the wound together. While factors like platelet-derived growth factor initiate tissue repair, and then the whole process is completed with fibrinolysis or breaking down of the clot and restoration of normal blood flow. There you have it, the process of hemostasis. This whole process, start to finish, can take a few weeks to months depending on the severity of the injury, overall health, circulatory function, nutrition, and if medical intervention was provided to help encourage wound healing and infection prevention. So the next time you get a bad cut and you want to say some explicit words, stop and take a moment to think about the amazing things going on in your body to start the healing process. It might just make you smile.